For the Pledge of Allegiance, please. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Well, thanks for coming, everyone. Good afternoon, and I'm going to be chairing the meeting today because Commissioner Vetch couldn't be with us today. So to start with board minutes, do we have anything to add or change in the board minutes from the 6/14 board meeting?
I'll make a motion to approve the minutes.
I'll second that.
Motion made and seconded. Any further discussion? If not, all in favor say aye.
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 Opposed? Motion carries. Review and approval of the agenda. Does anyone have anything to add or change from the agenda?
Yes, Mr. Chair, I'd like to remove and reschedule under the regular agenda, item 4, update on the Code of America benefits. Our presenter is not available today. I'd also just, not as a change, I just want to, for your awareness, our presenter for number 2 in the same area might be a few minutes late. If she is late, then I would suggest we start with number 3, and that presenter is available on virtually ever. So.
Okay.
Mr. Chair,
Yes, Commissioner Butter.
under the consent agenda, we usually have a cancellation of the second meeting unless there's a reason that you were going to have it. I don't know.
Are you saying that we omitted that this time?
Yes, I don't see it
I
on.
believe I do not have an agenda item for that meeting at this point, so can we please add cancellation, and I don't have the date.
July 19th.
Of the July 19th Patriots board meeting. Under the consent agenda.
Yes.
Mr. Chair, with that change, I will move approval of the agenda.
I'll second.
Okay, agenda is approved and seconded. Any further discussion? If not, all in favor say aye.
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 I do have a
Aye.
correction, I think it's July 26th,
Oh, okay.
not July 19th.
I'm sorry.
And that's for the consent. We're on the initial agenda
Right.
here first, but,
Yep.
okay, so any opposed to the regular agenda with those two
Aye.
changes? All right,
Oh, you're right. Yep. I goofed.
so that, all in favor say aye.
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 Aye. Okay, opposed? Motion carries. Consent agenda, anything to add or delete from the consent agenda?
I'll make a motion to approve the consent agenda.
I'll second that.
Okay. I had something to,
Oh, you wanted to pull something?
yes. I would like to pull for discussion the item number 2 under letter A, the Public Health Task Force reappointments. Anyone have anything else?
I'll amend my motion to accept consent agenda and pull item A2.
I'll second that.
And any further discussion? If not, all in favor say aye.
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 Opposed? Motion carries. So we had, the first thing was to add the note on the meeting, the cancellation. And we were going to cancel the July 19th meeting?
26th.
26th meeting. Okay. And anything else with that? Okay. And the next is the item 2 under letter A, the Public Health Task Force reappointment. And as I was getting ready for the meeting, I was looking at how this is set up for reappointments and term limits, because I saw it's approving the reappointments for July through December, so I found that there are July and December expirations on these term limits, including a couple in December. And there's an application process if you want to be a member on this board. And when you look at the website, it talks about submitting your application and then going through the submission process, but there isn't any reference to any kind of dates on if you want to apply for the spots that are ending with the term of December, you need to have your application in by June or some other deadline. And for me, looking at this, I would say that if I'm interested in the one ending in December, I would probably have a couple more months besides July here where we're at, looking at reappointing these folks who don't end till December. So then I looked at, what do we have to kind of measure how these folks are doing, these three. So I looked at past meeting minutes for the past couple of years, and I'll just give you some totals for what I had because I think it's relevant, because what do we have for a measurement on these folks of how things are going? I'm not at those meetings, but I did an attendance count off the meeting minutes, and I found that one of the three up for re-election is at 95%, 20 of 21 meetings they've made. The next one up for reappointment is 9 out of 15, and theirs is shorter because their term started later than the other one. And then the next one has made 8 out of 21 meetings, 38% of the meetings, including about 2 years worth where that person is the vice chair. And to make some kind of measurement or standard here, I think that we could do better with the service of someone on the committee than 38%. So I've had conversations with folks and seen where we had interest in these positions, and had a conversation with someone that ready, willing, and able to serve, and we looked at the process here and that it's on the agenda today. So they started filling out the process, and of course, me being new, we're kind of working through the deadlines and term limits and what's all involved here. So we have a ready, willing, and able candidate with experience that's here today. Linda Carlson is her name, and she's with us. So my point is that the time scale of the term and when we're looking at these, it seems to lack disclosure and transparency for the public that would be interested in signing up, but just your normal timeline would seem like you'd have more time than July to sign up for something that ends in December. So I guess that's what I wanted to bring up and address here, and I would make a motion that we have a candidate here that I think could better serve than a 38% of attendance. And if our candidate that I have found does not make those, the standards and process, which is an interview and everything else, then I would make a motion to table or continue this until this process could be addressed at another meeting.
Oh, Mr. Chair, so you're looking at, like, if their term ends in December, then we really would be looking to fill it in October or November rather than the July deadline. So if it's July, then it's May or June, and if it's December, it's October or November. Or we kind of advertise, put out, that's what we've done in the past, like we have an opening for this committee and, ask for people to apply. So is that what you're proposing? Yes,
and the language is on there. It says, we are looking for interested people with no reference to deadline. Now, if we only met 2 times a year, then maybe there'd be a sense of urgency to address it in July. But we have more meetings between now and the end of the year that we could go through this process. So, the whole timeline is thrown way off here for the public and me as a commissioner to look at this.
And I was just going to say that actually the way that we approach this is much more fluid. We don't necessarily replace one member with the other member, that we have the language on our website encouraging people to apply because we do welcome new members. I don't think we have a limit on members, and so we wouldn't necessarily be asking one member to wait until another member is no longer on the board. We would have additional positions. We actually have never filled our positions, I don't believe, to the level that we would like to see. see them. And then just so for your information, I think within the last year is when we add language to our bylaws regarding attendance. I think before that we did not have, am I correct? Look at Amy, we added language to our bylaws to reflect attendance. So something that wasn't part of the bylaws before this, but I think there is specific language now in the bylaws that denotes what the attendance level should be for continued participation.
So with that, did the board, going through this process before we got it today, go through the attendance with the folks that are up for reappointment and make any notations or address any of that, like what I brought up?
A year ago, we did bring all three of other committees to the board with the relevant attendance. When we brought the language to the board. I think it was about a year ago that we addressed the attendance levels and brought all the members' participation levels at that time. So no, to answer your question, we've not provided this board with the people that are on our existing, on our agenda, what their attendance levels are. I do have the attendance levels for this year for the Public Health Task Force. Like that, just for the three that are up. I've got Melissa Pools, Jason Franzen's, and Joshua Ryder's attendance. With Melissa with 6 attendances, Jason with 3 attendances, and Joshua with 2 attendances.
Okay. So, anyone else have anything else to
I guess,
add?
Mr. Chair, that I think it's good to, really take a look at this, because if people are not able to make the meetings, then I don't think they should necessarily have a seat either, because it's not fair to the people that are attending. And, you might have interested, like you said, there's not a limit per se, but it's good to have people that are going to show up. I mean, that's, why you sign up. And, I don't know, I'm not.
Occasionally, and we do ask for people to be, if they're not going to be there, so they would have an excused absence. It's not really noted here whether it was an excused absence or not.
Yeah.
And we do, and when we see that there is kind of a non-participation over a period of time, we certainly reach out to them to see whether it's their intent to continue on the committee or not.
Yeah.
But I'm certainly open to suggestions the board has on how we go forward.
Mr. Chair, I think if you have 6 meetings per year, I don't think it's unreasonable to say, you need to be at 4 of these meetings. If you have 12 meetings a year, I don't think it's unreasonable to say you have to be at least 9, whatever you think is a fair number. But I don't know why. So.
Sarah had something she wanted.
Oh, Sarah's saying that, I believe the attendance is in the bylaws for I know, but it's in the bylaws for the Human Service Advisory Committee, but we do not have it. They've not been updated for the Public Health Task Force or the Mental Health Task Force.
Mr. Chair,
Yes, Commissioner Witter.
what do you have for a quorum number? How many do you have to have?
Yeah. And we have to do that
And a
to
half
check
plus.
quorum.
Do you usually have it, even though there's so many that
It's
don't?
about 50-50.
Okay.
We have, and yeah, it's.
Because that's important, otherwise,
Absolutely is.
why
I'd
show
love
up
to see
if there's
robust
not?
attendance and,
Yeah.
good participation. So it's been something that we've struggled with, and one of the reasons why we did introduce, at least in the HSAC committee, the attendance, because yes, and I think sometimes when we only have, we have our meetings during the day, and that's something that we've discussed with our board members before. Potentially, we would have better attendance if we had them later in the day after people's work schedules. But so far, when we've brought that issue up with our members, they seem to like it when we have them scheduled. But that's something we could review or have a, more debate about within our committees. So I would say I've been involved with this for many years, and this is kind of what we've always struggled with, is getting great people on, keeping them on, and serving that attendance.
I guess I would like to make a recommendation that we have a fair and consistent attendance policy that sounds like we have it implemented in some areas but not in others. And I'd like, I guess by the next time we meet, to have something that's formal across the board for this, and then in meeting minutes, if you want to go the excused or unexcused route, all we've got is the meeting minutes. And when I look, if I see somebody's there, not there, that's it. If there's, sometimes I see in meeting minutes where it says excused, or not, or, that's all we got to work with. So if we're gonna have the rules, we also need the notation, otherwise they're absent, they're absent.
So I think I'm just kind of thinking out loud, then at these particular, I think what would have to happen then is within each of the task forces is when we would bring the revised bylaws back for ratification within the membership, and I'm not sure if that's going to happen before we meet here again. So it might be a timing issue, but I would say over the course of the summer, before the end of August, I think all of our groups would have an opportunity to meet. But if there's no quorum, we can't take a vote.
Right, that's the problem.
So it's kind of back to that catch-22 a little bit. But I think what we'll do is we'll put that agenda item on each of our public health task force and our mental health task force, and then let you know what the status is and meet. And we'll introduce the language. I'll have to kind of find do you have the language pulled up that I'll need from we'll find the language that we have adopted in the docs and bring it.
Yes, Commissioner Yusuf?
And that is frustrating because you go to this meeting and you haven't got a quorum, and you've got 12 or 14 people on the list, so you need to have 7 people there, 6 people there, and you don't, and so then you can't conduct official business. You can go through everything, but you can't make a motion or approve anything. So if there's 4 people on there that are consistently gone, they should just not be on there, because that drives, the number of people that you have to have for a quorum. So
we've been working toward that end, and actually, Commissioner Houston was on our last HSAC, and it was one of our very good members who's always at all of the meetings. It was his last meeting, and he had an excused absence not to be there. So because that was his last meeting, we didn't reach a quorum. So if we had him taken out a month earlier, we would have reached a quorum.
Right.
So that was a difficulty with that particular meeting. But I think we're trying to navigate this and not necessarily penalize people that can't come, because we know it's a commitment on their part, but it's also their busy lives, but find a kind of a good balance where we can meet, where they can be there. Virtually, I thought it might offer people more opportunities to be present, but we really didn't. I would say we didn't really see any higher participation while it was virtual than we did before that.
Well, I think it's good timing, because when virtual went away and we're back to in person, I've already seen more meetings that, hey, sorry, we aren't going to meet because we can't meet the quorum. And if you'd have done virtual, or when we were doing that, there were less of those cancellation of meetings. We probably all saw that. So I think it's good timing to bring that up at this time also. But as far as these reappointments, I would make a recommendation to reappoint the 2 that have the high attendance, and the 3rd either to continue or table until we can entertain other candidates, or we proceed today and let our candidate that's here speak to us.
Well, I would say that we would bring forward a new candidate without virtue of needing to leave off anybody. So, and we would, because we just got her application, I'm speaking about Linda, I don't know if Linda raised her hand. Linda, we received her application this morning at about 10 or 11 o'clock, so I would certainly put her forward at our next meeting as a candidate to join the committee, and then the board would just need to approve it, unless I'm fine with proceeding that way now if you wanted to.
Well, I would like to trade her for the 38% attendance over 2.5 years. That's not acceptable with a lot of time to correct it, and it didn't. So I guess that, and then with the role of a vice chair and not putting in that time, I think that speaks for itself. And I mean, if you're just interested in having another name on a column of people, that's one thing, but I don't think it's just serving the whole board and the public to have something like that.
I'm just trying to think through the mechanics of it, because this request is to renew when they would become renewable within this, so that candidate would still stay on the committee right now until their term would expire, which is in December. And what I'm saying is that we would not require
Reappoint.
Linda to wait until December
right.
to join the committee.
Yep.
In the meantime, we can have conversations with that member to encourage participation, and then if we adopted the participation that into that committee, that might also speak to whether or not they would continue to serve at that point. Does that make sense?
Yeah.
It does, I want to make sure that this 38% is not continued to be acceptable. And because
Mr.
two and a
Chair, you
half
could-
years before it came up here and now we're bringing it up, I don't know if it got brought up before or not, but whatever was happening is,
We talked about it in this committee, or in this.
Normally, we always have such a shortage of people, members that are interested.
Yeah.
It's never been an issue, really. I mean,
Except
yeah,
for the
you don't want
corner
to show
thing.
up, fine, but we've never had enough people that have had an interest in joining. Yeah, well, mental health is the worst one. I think a lot of it's Diane, but, don't mention it.
and I appreciate that. You wonder how, okay, this person's allowed to tag along, but then he's appointed vice chair twice. And to me, that's a bad example to the rest, for one thing.
Well, because he wasn't there was why
I
he
was
was
gonna,
appointed.
I was gonna say, because,
Yeah,
Because they're elected, you know, by the peers on the committee.
and Mr. Chair, I think that it would be good when his term ends, that just not to reappoint, you know? And that's what we vote on, to appoint or reappoint people to their terms when they end, so it's gonna end in December. So you can take on, you know, Linda now, and, I mean,
Well, it
I
wasn't
think we
on-
should strive
It
to
wasn't on
get,
the agenda. And
yeah,
we already approved the agenda, so it'll have to be next month.
right.
Yep.
So, I mean, when we can bring, we wouldn't have to wait till December, I mean, to
No,
bring Linda on.
So you could pull the one individual, we could monitor attendance and then see whether or not we would bring him forward later on this year based on the information on renewing. So we would request that he be renewed right now. And I believe Public Health Director Sarah would like to bring up some information that's in the Public Health Task Force bylaws.
Yes, thank you, Sarah.
So I think it's important to describe the process on how an applicant comes in. So they come in through that external process. They, Patty, who manages the committee from the administrative standpoint, sets up a meeting with me and we review all the bylaws and expectations at that time. In that, I also make sure that they meet the membership requirements. So we've gone through a process where the member has to be in the community, they have to be community resident, or they have to provide a service in the community. And that was a change we made about probably 2 years ago now, because we had people who, for instance, they work at Monticello Hospital and they want to be involved, but they live in Big Lake. Right now, they don't meet that requirement, but we want them to be engaged. And I know that the Mental Health Advisory Committee did a thing. We also have a membership composition requirement that 2/3 have to provide health services, with at least 3 of them being licensed health professionals, one of them a physician, one of them a nurse, and preferably 1/3 customers or constituents of the community or community organizations. And then that we have a minimum number and a maximum number, but it's basically rolling. So what I do with that individual, and I would do with Linda, would say, in fact, we didn't have a meeting this month, so she didn't miss anything. We would have been this morning. I invite them to the meeting the morning of the day that they would be appointed. And they're very welcome to attend and then see how it goes. And assuming they're going for their appointment, it would stay on the agenda. If they all of a sudden went to the meeting and said, this is not for me, I could pull them from the afternoon agenda, but that's how we work it. So they're right in there the first meeting that they're eligible for.
Thank you. So do we have to make this as a recommendation or a motion if we want to reappoint the 2 out of the 3, and the third one we're going to table for now and allow the process to go forward for Linda Carlson? Does this have to be
Yeah, we can
recommended
have-
for a regular board meeting, or do we make the motion here?
No, I think that's correct, Mr. Chair. You can go ahead and, you know, one of us can make that motion.
Okay.
And we could pull the one that with the low attendance. We
Okay,
could pull them and table that for another month.
okay. I'll make a motion then that we,
You can't. You're the chair.
okay.
unless she steps down.
Yeah,
All right.
unless you pull.
All right, do we have a motion?
I will make that motion, Mr. Chair.
Okay, a motion's been made to reappoint Melissa Pribble and Joshua Ryder to another term on the Public Health Task Force, and to table the reappointment of Jason Franzen to be continued for another meeting. Is there a second?
I'll second it.
Seconded by Commissioner Delyden. Any further discussion? If not, all in favor say aye.
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 Aye. Opposed? Motion carries.
Mr. Chair, I think we're missing Stephanie Barnes from the mental health, or are we just discussing public health task force?
That's the only one I pulled was,
The
Okay.
public health was the only one he pulled.
Oh, I
right.
see.
So the other, rest of it's all cool.
Okay. So make a motion to accept the consent agenda with that motion?
No,
we already did.
Okay.
approved it.
All right,
We're good.
so we're on to
New hires.
new hires.
So we have 4 new hires, and they are all present here today, board. So with that, I would like to introduce Christina Coleman. Like to stand, Christina? She is our new social worker in our child protection team, and she started on June 21st. Yep. So welcome, Christina.
Hello,
So you're
Christina.
seasoned by now.
Yeah, I am seasoned. I've seen her a lot, I'll say that. Out and about, so.
Welcome to Wright County.
Wait, don't sit down yet.
No,
Commissioner
there's
Delyden?
all sorts of questions you have to answer.
Go to the podium. I actually live in Ramsey, Anoka County. I grew up in Big Lake for a period of time, so I'm familiar. Prior to Wright County, I worked at the Minnesota Brain Injury Alliance, Minnesota Stroke Association. For years. So I used to be part of the county.
That's all it takes, Rob.
I know. The interview process was very enjoyable. It was like my first in-person interview in a long time. We were socially distanced, but yeah, really enjoying getting to know my role within the department. And
Great.
Good.
Well, welcome.
Welcome to the Wright County.
Okay.
Hopefully sometime in the future you'll learn to live in the Wright County.
And I'll have to let the board know that I had about a dozen people at our new worker orientation with the director last week. And I think they have PTSD because all of them felt like they had to confess if they did not live in Wright County. That's how they started it out. It's like, it's okay. It's okay. Thank you.
See what you started, Mark?
Yeah, I know.
It's all because of the fear of Mark.
Maybe
I
also
don't
Samantha Pettit. She's
I think
also a
so,
social
Mark.
worker, and she is in our mental and chemical health team, and she reports to Diane. So welcome, Samantha.
thank you.
I'm sorry. No, really, she's good. She's okay.
Hey, so far so good on my end.
So where are you from? Where'd you grow up?
Well, originally I'm from Rockford and Corcoran, so not too far from here.
Good.
I'm moving down from Grand Rapids, Minnesota, so I'm moving to Greenfield, but staying with family for the meantime.
So you're moving, you said,
I've been up in Grand Rapids, Minnesota for the last few
Okay, got
years,
it. And
moving
now
back down
to Greenfield.
where my
Okay,
family's
got it.
from.
cool.
So we're happy you made that life decision, and I forgot to mention that she started on July 6th.
Okay.
Living
Welcome.
on the wrong side of the river, though.
Right.
I know. So darn close, though.
Yeah.
Yeah.
Well, I always say I can spit on the other, but better not be seen by anybody doing that.
Board, I'd also like to
You're welcome.
introduce, I have Carla Coleman with us today. She's our new case aide in the same team, the mental and chemical health team, and she also started on July 6th, so Diane had 2 brand new people on the same day.
Good.
You know the routine now. Go ahead.
So I moved to Wright County when I was 3.
Oh, good.
Actually have lived here, but maybe 5 years when I got school up here. So moved back and I've been here
where in Wright
Where,
County?
yeah.
Okay. Good.
Kindergarten through.
Wow.
Good.
Welcome.
Has a lot of lifers, it seems like. Yeah. Thank you, Carla.
Welcome.
Yeah, so a brand new worker, a brand new staff person started today is Joshua Bollick. He's our new technology coordinator, which actually was a position that, no, I got the wrong one now. No, so this is a position that Misty had been in before, and Misty was promoted to our new position that the board approved last year. And as a result, we were able to hire Joshua to come in and be our new technology coordinator, and he reports to Jim with us.
Good.
Good, congratulations.
Yeah.
Yeah.
Welcome aboard.
Welcome.
So where'd you come from?
I grew up in the St. Cloud area. About 10 years ago, I moved to Annandale and love it.
Yeah. Good.
So you lived in the Wright County, now you get to work in the Wright County.
Yes.
Life can't get any better now.
That's why we saved it for last, so you can stay that.
Yeah.
Thank you.
We're glad to have you all on board.
Welcome.
Yeah.
All right, next item, Employee of the Month for August.
Yep, I guess I'll stay standing up. And actually, if I could ask Erin to join me at the podium. Board, this is Erin Kodish. She is our August Employee of the Month. Erin is an adult mental health, so case manager since August 2015. So also reports to Diane. My gosh, Diane. In addition to case management, Erin completes commitment screenings, chemical health eligibility and assessments, and is on the SAG committee. SAG, oh gosh, Staff Appreciation Group Committee, and is the potluck organizer for the team. Her nominator states in part, the mental and chemical health unit is so lucky to have Erin on our team. Erin never forgets a coworker's birthday or special event. She even recently made ham and potatoes for me when I had a family emergency. Erin has been in the office most days throughout the pandemic and is always willing to help. Covering backup during a pandemic when most people are working safely and remotely is a big deal, and Erin is always eager to help. Erin also volunteered to help with CD tasks, so chemical dependency tasks, and is very active in helping in that area despite her own caseload. Erin is an incredible social worker. She truly cares about the people she supports. She knows her clients, she listens to them, and she does a fantastic job connecting them with the resources they need. Erin shows up. She is professional and responsive. This pandemic has been a roller coaster for everyone, and I can't imagine being on this ride with any other team, especially a team without Erin. So Erin deserves a big shout out. Thank you, Erin, for always having your team and your clients back, and we appreciate you. So thanks, Erin. She really does the potluck very well, and I'm very happy to say they're always on one of the conference rooms on either side of me, so I invariably get an invite, so it's always really nice. So, do you want to say anything, Erin? Okay.
You have to.
Congratulations.
Yeah. Thank you for your efforts. We appreciate
I'm going to
that.
ask her where she lives.
She gets a pass.
All right, moving on to the regular agenda.
Actually,
First-
oh yeah, we already approved. No, sorry.
Okay.
Mr. Chair.
Social services / public health / financial services. Number 1, accept the resolution, Health and Human Services 21-02, June donation.
I'll make a motion to accept the resolution approving donations.
I'll second that.
Motion made and seconded. Any further discussion? All in favor, say aye.
It's a
Aye.
resolution.
Resolution, roll call.
Roll call vote. Catch mark aye.
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 Opposed? Motion carries. Number 2, presentation Rivers of Hope by Executive Director. Is she here or? Okay.
Okay, come on up, please.
Teresa McNamee.
Teresa McNamee is here to provide some information regarding the Rivers of Hope. She's the executive director. We work in collaboration with Rivers of Hope, and Michelle oversees that contact area. Welcome, Teresa.
Thank you. Thank you for having me. I have a couple handouts if, just some PowerPoint slides. I do this presentation out in the community. So some of this I'll kind of highlight, but want to give you the information for a reference. So in the PowerPoint, I start off by talking about our mission at Rivers of Hope. Our mission is to provide a community coordinated response to end family violence through advocacy, education, and interagency collaboration. I I want to start off by talking about what we define relationship violence as, or relationship abuse as. For our agency's purposes, we have a pretty expanded definition of relationship abuse, including domestic violence and family violence, which is what we're often known for our adult services. Intimate partner violence is a part of that. I also want to just mention that we have youth programming, which our contract also covers for 20% of our services. We can provide services directly to youth. And that includes victims of teen dating violence. So when we talk about relationship abuse, we are really encompassing a broad range of what relationship abuse could look like. We do address some bullying issues, but not necessarily as like a bullying program. But some of the students that we come in contact with in the school setting are experiencing bullying as well, and so our youth advocates are prepared to address that for relationship violence. In the presentation materials I gave you also has some statistics at the national and state level that I just want to highlight as a reference there. We use a lot of that information just to give some context for the prevalence of domestic and family violence in our communities. The student survey data also gives us a lot of good information about what the prevalence is in our communities. In Wright County, 9 to 11% of 8th grade to 11th grade students have witnessed or experienced family or direct abuse to themselves. And so that's just really important to kind of identify the scope that we're working within, 9 to 11% of high school students. One statistic that I want to highlight around teen dating violence, 20% of female 11th grade students reported in the student survey that they've already experienced verbal abuse and controlling behaviors in their relationships. And that's an important statistic to highlight because what we know about domestic and family violence, it starts with power and control and often with emotional and verbal abuse. And so when 20% of female 11th grade students in Wright County experience that, it really indicates a valuable, it indicates an importance for us to get into the schools and talk with students early so that they understand what healthy relationships are and what might be warning signs of abuse so that physical violence isn't something that they face in the future. So our services, as I mentioned, we have we're often known for our services for adults, and that comes in the form of individual advocacy, primarily through crisis interventions and civil and criminal court advocacy. That advocacy also shows up in the school setting through our youth program and out in the community setting. Unfortunately, in the last year and a half, we've been present in the community for some fatalities due to domestic and family violence. We've been involved with raising awareness around concerns when those fatalities occur and trying to prevent those in the future as sort of an education piece after that. So that community advocacy is an area of Rivers of Hope services that has grown in the last 2 years. That coupled with our education services, one-on-one skill development, support groups, and general community outreach, again, is part of our mission and continues to grow. In the aftermath of COVID, we've learned to be more present through social media and online so that we can reach more folks, and we've seen our numbers grow from that outreach. We also focus our mission on interagency collaboration. We cannot do our work without collaboration as we have with Health and Human Services, with our representatives in the communities, our commissioners like yourselves, as well as law enforcement, county attorneys, and other nonprofits in the community. We really find strength in that collaboration to end family violence through coordination of services at every level. In Wright County, we actually help to facilitate the violence response team, which is a collaboration between law enforcement, county attorneys' offices, mental health providers, public health departments, and other social service agencies to manage and address domestic and sexual violence in our communities. The last couple slides of information that I'm sharing also provide some some organizational statistics over the last 2 to 3 years, so since 2019. In 2020, we served 721 individuals
We're already over 50% of those numbers through June of this year. We're close to 500 individuals served already this year. And between 2019 and 2020, we saw a 20% increase. So those numbers just continue to grow. Month-to-month statistics are actually even more telling of what the current situation is for those we serve. Our average monthly contacts have increased by over 50% from 2019 to 2020, and we're seeing that trend even greater this year, about 60% greater, meaning that in a specific month, we might have 50% more, 60% more contacts with clients in a given month, meaning that we're serving more clients in a given month than we have in previous years. Those contacts have been more intense, focused a lot more on mental health resources and needs, which we don't provide mental health services, but we get people to the right resources for that. And then housing and economic insecurity, which are also beyond our scope of services. So a lot of intense calls around that, just taking more time. The youth program continues to grow as well. We did see a dip in June in our numbers this year because students are needing a break from our youth advocates. Last spring, we saw a 70% decline when schools closed in our contacts with students, but we continue to reach out to them. This year, contact continued to be steady through the end of the school year, but then as the summer goes on, students are self-selecting of whether or not they want contact. So, and then I just have my contact information. So, any questions?
Mr. Chair,
Yes, Commissioner Deline.
do you do just Wright County or do you do the other counties too?
So Rivers of Hope serves Wright County and Sherburne County. We've been around for 32 years now, and we started in Sherburne County and Elk River, but within 3 years moved into Wright County, and we're centrally located in Monticello, but we serve the entirety of both counties.
You know, that 700 or whatever it was that you had said that you served last year, is that between both counties or is
It's
that
between
just
both
Wright?
counties.
Okay.
Yep, and Wright County is about 52% of our numbers. We're just slightly more covered in Wright County.
Well, we got quite a bit more of a population than Sherburne County does.
And we are in about 15 school districts, school systems, and all of the school systems in Wright County public school districts receive some sort of services from us, either through individual services or our presentations in the schools.
Mr. Chair.
Yes, Commissioner Wetter.
How many of these do you consider the main problem is maybe drinking or drugs of some sort? Either the parents or the kids, you know?
That's a great question. I would say that the problem isn't necessarily the drinking. I think that's a symptom of some challenges in the family. Domestic and family violence, relationship violence stems from a foundation of values and beliefs that are focused on power and control and how people obtain that. So substance abuse definitely can increase the risk of something becoming violent. But as I mentioned with some of those youth statistics, relationship violence tends to not start with the physical, it starts with the emotional or verbal, which ties into substance use too, so mental health needs.
Commissioner Houston.
I really appreciate that you're in the schools, and I know, like, at the Safe Schools meetings, you know, we're working with these kids about, you know, what is really dating violence, and they don't have a concept a lot of what is a healthy relationship. And the fact that you're doing the texting too, I think is really a great way for the kids to get in touch with your workers, and so I appreciate that.
Yes, we've been really grateful for some upgrades to technology for us to do video conferencing as well as texting and that kind of communication. Students reach out to us, our advocates at all hours, even if they're not technically on the crisis lines. And we've actually had to do some welfare checks as a result of both students and school administrators reaching out to us worried about students.
Okay.
And the relationship violence piece with students and defining that, we've actually had students come and self-refer after they see the presentation and say, I think I'm in a relationship I shouldn't be. And so then they want to talk to an advocate about it. And On the adult side, what we've been working on with law enforcement agencies is to start talking with us about situations where there's non-arrests, so that we can have similar conversations with adults, talking about the relationship, that they don't necessarily have to stay in that relationship. If police are getting called, even if an arrest isn't made, police are getting called on a situation, let's get involved earlier. So we're really trying to kind of raise awareness about our capacity to do that.
Mr. Chair.
Yes, Commissioner
Another
Wetter.
question. How many are on your staff?
Currently, we have 10 staff. Each county has a designated advocate on each team, so a youth advocate and an adult advocate. And then we have a team lead on each team that helps to support them. And then we have 4 administrative staff. We're actually currently growing our adult team. We're shifting from 3 advocates at 1.0 FTEs to 4 advocates at 0.8 FTEs. Hoping to kind of manage the capacity needs that we have, while also helping to balance the vicarious trauma impact that's happening in our staff.
Mr. Chair,
Commissioner Newsom.
yeah, Teresa, do you have more than one safe house now, or was there one in?
We currently don't have a safe house.
You don't right
Our
now,
safe
okay.
house actually closed in 2018, before my time. It was my understanding that the capacity of the organization and the financial needs at the time led to that decision. We work really closely with shelters in St. Cloud, so Anna Marie's Alliance and Alexandria House are primary contacts that we work with for shelters, but we also work with the statewide crisis line, Day One, to help support getting shelters. We currently do emergency hotel stays, that if a shelter isn't available or if it's not the best place for them to go, we help support them with an emergency hotel.
Okay, thank you.
I'm going to ask about how your, and I can tell as well, how your services align with our sexually exploited youth program. Is there much overlay, or is that really kind of a county look at that?
Great question. So Rivers of Hope is a domestic violence advocacy agency. We're not a dual agency. So we actually don't provide services specifically to sexual assault victims, although they overlap. So we might have someone come into our services that's also been sexually assaulted. We continue to work with them on the advocacy level around the family violence piece, and then collaborate with the Central Minnesota Sexual Assault Center, because they have on-scene advocates as well as specialized support groups and services for sexual assault victims who may not know their attacker or need some specialized support. I would say though, as of the end of the summer, all but two of my staff will be trained as sexual assault advocates, so we do have that training. We just don't provide those explicit services.
Teresa, thanks for coming in. Appreciate your efforts. And probably the right answer always in a public meeting on safe house is that you don't have them. Right? But as far as other feedback related to law enforcement and victims, more often than not, if they call you for service, a real person answers the phone.
Correct.
And that means a lot. I know that from experience, that everyone appreciates that.
Yes, yeah, and we are very thankful for our partnerships with law enforcement in both counties, Wright County in particular. I've been on a couple of the crisis line calls where a sheriff's deputy didn't need me even to say anything about Rivers of Hope, because they knew what we did, they knew what the victim needed to hear, and they were advocating for them in that situation. So we've been really lucky with those interactions with law enforcement.
Thank you.
So, thank you.
Thank you for what you do, Teresa.
Thank you, very informative.
Okay, next is presentation, Safe Families, Community Coordinator, or is it Diane or Amy?
We have Amy Peterson with us, actually, and she is on virtual.
The technology guy?
Yeah.
Can you,
1 second.
she's trying to,
There we go.
she was trying to hide.
She's hiding behind a band. Yep.
Yes, so Amy
Yeah, she's
Peterson
good
is here
now.
with us. She's from Safe Families. A number of our commissioners have been very involved with Safe Families. We've grown our opportunities with working with them, and we've seen great growth and great potential. And if you recall, this is also an area that we have an ask in with our American Rescue Plan. And with that, I will turn it on over to Amy. Welcome, Amy.
Thank you. Hello, everyone. I'm just going to try to share my screen. Let's see if I can do that here. Let's see. Can you see my screen?
No.
No. I'm a little bit new to this technology. I'm more of a Zoom gal. Let's see.
We do have the PowerPoint,
A few
but.
years ago, a Zoom gal, but now we know what it is.
Let's see.
Jim, can you walk her through it?
Oh, how about this?
Up at the top right by your microphone,
Here we go.
there's a little square.
There you go.
There.
You got it.
Yeah, so all you had to do
See,
is just call him
technology.
Jim.
Love it. Okay, let's get this into slide. There we go. All right. So I just want to thank you so much for having me here. And Teresa, love what you guys do at Rivers of Hope. So glad you're doing what you're doing. And welcome all the new members of the Health and Human Services team. Now I have a whole new group to learn. But I just want to share a little bit today of what we at Safe Families, who we are, and then I'll do an update of what we have done in Wright County. So we are a movement of families supporting children and parents in their communities. So we step into this gap of when families are going through a really tough time where you and I have the ability to rely on friends and relatives for support, but our families are dealing with social isolation. So there's no indication of harm or neglect to a child in these situations, but these parents are struggling, and the next time there's, perhaps a CPS checkup, the story may look a little bit different. So we want to wrap around parents experiencing a crisis and be able to provide support to that parent so they can be the parent that they want to be. Our objectives at Safe Families, number one, is we want to prevent child abuse. We simply know that when parents are overwhelmed and their resources are limited, there can be that need for support and not lose custody of the children because of a poor decision that was made. We also want to be a safe alternative to the child welfare system. There are so many children who need that foster care system, that extra help. But if we can intervene earlier, we can deflect a lot of those children out of the child welfare system. And then we want to be able to provide family support, stabilization, and preservation of that family unit when it's possible. So who do we serve? Many of you have heard some of these situations here today: homelessness, domestic violence, mental health issues, medical crisis, young moms. I do want to let you know we do serve, single dads as well, but predominantly it is those single moms that come asking for support. And just a family in need of that extended family support. Perhaps they're new to the area. Maybe they've just gone to the family bank, we call it, one too many times. But we can be that network of support where currently none exist. And who do we host? Who do we serve? So we host children between the ages of 0 to 18. About 70% of the children we do serve are less than 6 years of age. And we can make special arrangements for a teenage mom and their children. We want to host them together. So it kind of depends on the age of that teen mom. If they're 18 and older, we can work directly with that mom. If they're under 18, we have to get that mom's permission from their parents. So we kind of do that on a case-by-case basis. And why are families important to us? So the family is the most powerful change agent in our society. And what we have great success at is, rather than just keeping our families as the unit unto ourselves, when we unleash those families and allow those to wrap around those in their community that need support, it has a transformational change and influence on those families. It allows a family unit to serve and minister together. And then for there to be this lasting impact in the community, the civic groups, the churches that are all doing wonderful work in the community, we need to use the homes and reach people through relationships. So we have a lot of wonderful organizations that provide what I call goods and services. So a lot of transactional, and they're key. They're so key when you think about, you know, shelters, being able to furnish a new apartment, mental health resources, all those things. But it can't simply just be transactional. It needs to be relational. And that's where Safe Families really steps in. So what we want to do is we want to mobilize families in communities to serve other families. So there's various ways that we do this. So we have roles where we just simply need people that can provide goods and services. You know, we have this family friend role where during COVID-19, we had to totally change how Safe Families work. So no longer were we hosting children in our homes. We were actually being that voice on the other end of the phone that just simply listened and provided support to families that were going through a tough time. We have those host homes. These are families that open their homes to love and care for children in their own homes. And then we have family coaches. This is what really helps us stand out from a lot of other agencies, in that we provide coaching for our families to have them set goals. And part of being in our program is that we want to see movement from the families we're serving towards reaching their goals. Now, we don't put a time limit. We're not a 30-day program. We're not a 90-day program. But when we've been supporting and serving a family for, 9 months to a year, we should start seeing some movement towards reaching those goals. If we're not, then we simply need to sit down, really look at the goals. Do they need to be adjusted? Do they need to be changed? Do we need to add some more incremental steps to get these families where they want to be? So we want to see our families move from simply surviving day to day to thriving. So what does it look like for a family to step through the front doors at Safe Families for Children? So if you picture in the center here, these are representative of families that are in need of support. So when we surround them in community with all of these key elements, resources, encouragement, safety, self-esteem, advocacy, we want to move people from being a consumer to a contributor, and as I mentioned, surviving to thriving. This is what a Safe Families community looks like. The family being supported and served is surrounded by community. And these roles, these families that are serving in community also serve one another. So it's not like just one family is taking on the sole responsibility in caring, supporting for another. They also serve in community. So just a little bit of fact information here. In 2019, Minnesota Social Services received roughly 87,000 intake reports. They deemed about 38,000 reports needed to be screened for investigation, but that left roughly 48,000, families that didn't meet the criteria for intervention. So you still have children and parents who needed love and support. So if we pare that down a little bit and look at Wright County, and I use the word approximation because I know this number changes, but on any given day, there's 140 children that are in placement in Wright County, and many of them did not need to be there had we had that opportunity to intervene earlier. So if you think about, a parent who could possibly be dealing with addiction, they don't seek help for that if they don't have a safe place for their children to go. So then it just perpetuates this cycle. So again, if we can intervene early and catch these families upstream, then the downstream processes can be avoided or at least averted in some way. So with Safe Families, we always feel that neglect or harm to a child should not be the catalyst for a call to action. It's about celebrating when a parent makes a good decision and asking for help. And that phone call is the toughest thing I think that many of parents have to do. But we too, just like Rivers of Hope, our phones are manned Monday through Friday from 8 to 5. If they don't get a live person, they leave a message and they will be followed up immediately when the next person becomes available to place that call. I just want to give you an update of where things are in Wright County. So I actually came on board in February of 2020, and then COVID hit. So all of the training that I had wasn't going to work because we had a really unique situation. But our church is closed, which is a main resource for us for motivating and developing volunteers. So I went to every chamber meeting, Lions Club, Rotary Club, Kiwanis Club, and I even hit a few VFWs. But through those connections, I was able to get into several churches. And here's a few of them that are listed that we are currently working with or in process with getting some volunteers approved. And I should let you know, because we do deal with children, all of our volunteers are vetted and trained. So by vetted, I mean they are background checked, their homes are assessed for safety. So it's very similar to foster care vetting, not as thorough, but very similar. So currently in Wright County, I have 13 volunteers who are approved and working and serving families. Since 2020, we have served 4 families, which roughly is 7 children. So there are 7 children that, we were able to keep a family intact with. And then we also have, outside of Wright County, I do have an Anoka County volunteer that's working, serving 2 children. The family does live in Wright County. We did have a Sherburne County family that Wright County was serving. And then I still have a Wright County family that's actually being served by a family that's in North Hennepin County. So we do cross the borders between counties. What we are looking for here is relationships that are sustainable. So it doesn't make sense to have a family in St. Paul trying to support and serve a family in Buffalo. That's a lot of mileage. So we want to try to develop relationships in close proximity. So here's some needs that are still out there that I'm still looking for support with. So we have a mom with having a scheduled C-section in September. So she's looking for care for her 4-year-old girl. Hopefully this is just because a lot of people are on vacation during the summer, but we'll get this one filled. And then we have just people looking for family friending. Albertville, this mom was recently separated, not by her choice. She's just had a new baby and she's just asking for someone to just walk alongside her. I had a single mom who I'm actually serving now with a teenage daughter. She just simply needs someone to talk with her on the phone. So, and I'm actually in Wright County on Thursdays. So, we can meet for coffee. But you can see just some of these needs that are just simply, someone just needs that support and that cheerleader. It's amazing how so many of our families, they forget to celebrate the small successes. And when we can help them do that, that really does a lot for their self-esteem and their ability to move forward. So what's next? So I need volunteers. I need those families that want to step up and serve families in their community, because when we strengthen families, we strengthen a community. I'm also a one-woman show here, so I'm doing fingerprinting, home assessments, fundraising. So anybody gifted in those areas, let me know, and I would love to talk with you more. Awareness. We need to make safe families for children kind of that key place when people are like, hey, how do I give back to my community? again, serving those in your community is a great way to stay connected. And then, celebrations. We want to be able to get the word out and tell our success stories. So I'm going to share one really quickly here in that we actually have a family that mom has an underlying medical condition. She was in and out of the hospital every other month. And she was just simply looking for someone to spend some time with her son, who has Asperger's. And we actually were able to pair them with a family from a church nearby. And they started a meal train. Nothing that was even asked by the parent, but nothing speaks love like food, right? I think of the potlucks you're having. So invite me. I love a good potluck. But food and love go hand in hand. It's a very easy gesture to show that you care. So since this time, this mom has not been in the hospital because I feel she's getting good nutrition and good support as well as her son. So she's able to still stay healthy. This son has never played more board games, the mom said, since this church has kind of come alongside them. And he's a big fisherman as well. And this family is now actually attending the church that served them because this mom was like, I want to be at a church who knows how to love people in their community. And finally, we want to host community cafes where we can provide continued growth for our families, everything from parenting skills to how to create a budget, just to help them, again, get on their feet and continue growing, not only for their own well-being, but for the well-being of their families. All right, any questions?
Mr. Chair.
Yes, Commissioner Dolan.
Amy, can you get us that PowerPoint presentation?
That's what I was gonna ask.
Actually, Amy has it.
Well, she didn't share it with us, so could you share it with us?
Amy, you can share that with them.
We have a couple different pages, but yeah, thank you, that'd be great.
No?
Yeah.
Thank you.
Thank you so much, I'm glad to see that we're kind of getting a little bit back on track, so it's great.
Yeah.
Thank
Yeah.
you, Amy. And just a reminder, board.
All right.
During our discussions of the American Rescue Plan, the request is for temporary contract position for safe families so they can expand the piece that Amy was talking about, getting the news out, finding the family, so then that position would end and we'd have a more robust, situation in place at that point to help children going forward. Thank you, Amy.
You're welcome.
Thanks for everything you do.
Yes,
Yeah.
important.
Okay, next, number 4 was removed. And then we have under administration, director's comments.
Right, so I do have, I think, comments for it. One of them is because we canceled our next meeting. Just a reminder and a heads up that Governor Walz signed the State of Minnesota proclamation where the Tuesday, July 27th is County Staff Appreciation Day. So I just want to thank the board for everything you do to support our staff and just I'll let you know yet again that we have great staff that we're very happy to have. And we have 4 new staff that will be having their first County Staff Appreciation Day.
What do we do?
I don't know. I don't know.
Oh, okay. Because it's never happened before?
It's kind of hosted through AMC, so, no, I'm just along for I'm a county staff, I'm just along for the ride, so.
Okay, so maybe chocolate or something?
Yeah, maybe.
Chocolate.
This is just a heads up, I believe, we'll be coming back, and Sarah will be doing a larger presentation on the reorganization. As you recall, Mary Nesseth retired, she was one of our longtime public health supervisor. So this is a 2-sided sheet, and we took the opportunity at the time of the resignation, along with transitioning from COVID and everything this past year brought into reorganizing a new our public health under, it's still 3. We've changed the names of our 3 teams. If you look at the side that has the positions versus the individuals' names, we have a collaborative health services. And I'm also announcing today, since it was just announced to staff today, that we have Mary's replacement has been named. It's Kelsey Collier, one of our public health nurses that has been with Lorraine County for about 2 years. She'll make a great addition to the supervisory team, and we're excited about that. And we'll also bring her in to introduce her to the board. We have Healthy Children and Family Services, and that'll be with Casey. She'll be the supervisor for that group, and if you notice the first, I'll come back to this, but the MESH, that's where our evidence-based family home visiting programs reside. And the last one looks like a lot of stuff, but it's our health promotion and protection, and that's John Young's team. It used to be just health promotion, and then we included that and protection. So those are the new names for our 3 teams. I'm sure there'll be some things that we need to do as far as working with administration and wherever we need to make some of those changes happen. The other side of you'll see who's actually in those positions. And so what I also wanted to, along with this reorganization, I wanted to let the board know that, and I believe I forwarded it to you via email, but the Minnesota Department of Health, under the local public health grants, has awarded Wright County an additional $87,023. That's in addition to our 2021 award grant, which was $269,354, for a total now in that area of $356,000. And that $87,000 is not just a one-time, this is added to our base. So this is an increase of $87,000 across the board for the public health activities that we do under the local public health area. So that leads me to my final question, and I'm not sure if this is something you just want to proceed with, or if you would request that it go to a personnel committee. And I see Lee's here, and I had a discussion with him on Friday last week with the addition of the $87,000. And if you recall, seems like a long time ago now, last year's budget, we were awarded an additional public health nurse to start on July 1st. And that was to support the grant funding that we had through the evidence-based nursing programs. We've since switched from the 2 programs to 1 program, which is called the MESH, and we've brought that to board discuss. It's maternal education, something.
You know, Jamie, that's what I was just going to suggest. Especially for our newer commissioners, having these letters here really should have something off to the side.
Oh, you see acronyms? I don't see the
It's
acronyms.
really made for staff, and I put it together quickly. So
Yeah, we just-
something more.
It just might be easier.
Yes, we will do something that's more actually friendly for me too, because obviously I struggle with that.
I was going to say, it's not that I would ever forget any what these
So
acronyms stand
My
for.
question and my ask, and it's kind of logistical, is that we have this position that's already been approved and it's in our budget, and it was being supported by the evidence-based family home programs. We'd like to keep the position, but just for total transparency, instead switch the funding that was supporting that position to this $87,000 coming in through the public health, through this fund, so we can use this position more widely to service our long-term care centers and our school-aged kids that we are basically lacking a position. And we'd be coming forward with requesting a position for this regardless. But funding is here. We're not asking for any additional positions. We can certainly forward the budget amendment that would show where that position is being funded from. So I wasn't just quite sure how you wanted to go through that. I'd be very happy if you just want to say, Jamie, you know what you're doing, go ahead and use your position to the way you think is going to best serve our community, or if you want a further discussion, we can certainly have a personnel committee. But this is a this year position that we'd like to move forward with hiring.
I think to stay with our process, to bring it to personnel.
And I'm not sure that that is our process necessarily, because we would potentially move people around at, like, in the middle of things. I think just because budget's coming up right now.
Well, yeah, I mean, it could be part of the, but,
Well,
Mr. Chair.
just so that I understand.
Yeah.
Now, you haven't hired the public health nurse that we gave you permission to hire, correct?
First July 1.
Oh, we did do.
We didn't hire,
We didn't
but
hire
it started,
because
but it just, like.
Oh, okay. So that position that we approved you to hire last year, instead of hiring that person, you want to hire a person.
It would still be a public health nurse, so nothing would change.
But yeah, but it would be, so it's
Okay.
still.
A different
It's
direction.
It would be a different direction.
Okay.
So then really, it is
Right.
budget neutral.
Then it is, yeah.
I just want to make sure that the board understands that we're supplanting this funding with this funding.
Yeah, you won't be hiring 2 public health nurses,
Because now that
only
we only
1.
have one, now that we only have the one
Okay.
program, we can better serve families that way. So this would be, I think, better all around for it. And we did find a lot of, we found we had some bandwidth issues during the pandemic, working with the schools that they demanded, or I shouldn't say demanded, that's not nice word. They were very demanding. They were looking for a lot more help from us and direction from us, and we were able to give, because even though we had people, you know, that we have co-located in the schools, once everything was kind of directed toward the pandemic, we didn't have any bandwidth to serve the schools the way that we could and should have been.
So that amount that we got will cover that
It's
person's...
$87,000, $96,000 is what we need, and what we just talked this morning with Christine, there's additional funding coming from, potentially from a workforce development area.
Yeah, there's multiple.
That would cover
So
the
we have-
addition.
We have our COVID grant, workforce development, pot of money that we just answered for, which was specifically around school. As well as we will be getting another innovations opportunity. That was the additional fund for public health. That will come from SHAC sometime after Labor Day.
So what I can commit to the board is that should we no longer have 100% funding, even if we only have 80% funding, that I would come back to the board and let you know what the status is of this position in case you wanted to go a different direction at that time.
So are you saying that cost of wages and benefits for this position is $97,000 a year?
Yes.
Okay.
Which would have been the same for the other.
For a starting position.
Which was the one approved a year ago?
Correct.
I just wanted to be clear because you were throwing
And it's
out the
already on record. I mean, it's-
87,000 and how that relates to the wages. Commissioner Houston?
Yeah, Mr. Chair, Administrator Kelly, is it appropriate to have this just put on the consent agenda with the explanation for approval? I mean, you know, we do have to approve it, so it's, you know, it's just it's a change, it's not but it's still a change, I guess.
You certainly could, as far as documentation. I think it would be kind of above what would be required, but it certainly would be a nice trail just to track that going forward.
Again, I want the transparency to be there. I honestly don't think it would be required, but we're happy to do it because we're basically just keeping ours both contingent. We're just supplanting one.
Right. It's just kind of nice to see that trail, you know, as Minister Kelly said. I mean, this is what happened and why.
Well, at least HR will definitely need to have something.
Yeah, and they'll have to have that.
So you could just forward that same information that they require.
Yeah, just be an informational item as I would see it. As it was discussed, it's not an additional FTE, it's just transferring
Right.
funding,
Yep.
so.
Yep.
You don't have to do anything, we'll take care of it. And just for your information, then on this side, where it says we actually, that position isn't listed, it would be under Casey and there, it's actually should be under Kelsey, that would actually exist right now, it's an existing vacancy, it's just not on the sheet. Or 7-1. Thank you very much, that's all I have. Thanks, Lee.
Thank you.
Oh, I'm sorry, one more item. I retract that's all, folks. Diane has information regarding the development the housing development that is being looked at for Delano, and has spoken with the folks that are pursuing that, and they have some additional information on how they would like to serve the community with their federally funded assisted apartments.
Yeah, so it's Connolly Development. They're the developers that have reached out to Wright County. They're proposing a 55-unit housing development, Granite Ridge Apartments in Delano. The address is 256 North River Street. The city is aware of the project and has approved it to move forward. Connolly Development is asking for the county to submit a housing support letter of commitment. So what that means is that if they were awarded their application through the Minnesota Housing and Finance Authority, that we would approve them for housing support at that time. They're proposing a 4-unit long-term homeless, so 4 long-term homeless units and 4 person with disability units. The referrals for long-term homeless units come through our coordinated entry through our Central Minnesota Continuum of Care. And then for the persons with disability units, those referrals come directly from Wright County case managers. If we don't have anybody for those units, then it can come from the coordinated entry list. So this is just another development that is submitting their application. I did meet with them and the housing support provider that they're proposing, which is Simpson Housing. I met with them June 17th, and I don't see any concerns with the project moving forward. Their application deadline is this week, July 15th.
And do they need our letter at the time of application?
Yep.
So this would be something that I could just do unless you want to make a motion.
Yep, I brought another one last month when we were talking about it. These folks were just a little bit after, we just got that information right at the last board meeting, so this is the full details for you all. And I did communicate with Commissioner Ketchmark with all the information as well, and he spoke with the developer.
I did, and just for those that aren't familiar, the old Granite Works project, they proposed 3 apartment buildings. They're starting on 1, and this one, I think, is the 3rd of 3 in the
Yeah.
project that's further down the road. And my question is, if we pledge housing support, does that mean, does our involvement end at the referral stage to where we say, if there are people in need, we'll refer them here, or does it involve any check writing to accommodate living in the homeless
We're not pledging any
units?
financial support. We're pledging that we'll work with them so they can best work with our agency and with the community to house people. They, my understanding is that under this program, they'll get fairly significant federal funding for the housing project. And in turn, they give us some units that we can use for.
So and this I think new maybe around the county, I'm not familiar with this in the past, but down the road, is there a possibility that they'd come asking for, hey, you know, we're struggling here, can you help with?
In my history, I've never heard of such a thing. They're on their own as far as finding tenants, running their business, you know, all those kinds of things. So I would say we have more than enough clients to keep them. Now, some of our clients might receive funding through our programs that would, you know, help them pay their rent and things like that, but it's not any tax levy dollars.
We have
I want to just make sure when we speak of support, what does that exactly mean? So thank you.
Yeah, we have a few developments already in the county. So Aloe Apartments, the one right behind the building here, right over here, that one does have some long-term homeless units in it, as well as Connects in St. Michael. That's a new building as well that has some long-term homeless units. The person with disability units are new to us. We don't have any of those in our county right now. The state just developed those within the last few years. So, and again, this is just for them to apply for those funds. It's up to that developer if they want to move forward if their application is not approved from Minnesota Housing Finance Authority. If it is approved, then they do get lots of tax benefits and stipends and things like that all through the state, but not through us.
Commissioner Ketchmark?
Yes, Commissioner Deline.
Yeah, there are a few of them. I think even at St. Michael, workforce housing is another similar program. You know, so they're only giving up, they have 55 units, they're only giving up 8 units that are still going to be partially funded. The rest of them are still going to be rented out for whatever the going rate is in Delano.
Yes.
So it's the chances of them ever needing money.
And it's nice that as a referring agency for those disabilities that we're the first one in the door when we have clients that have a need that we can get them housed, which is really nice. So it's not bringing in folks from surrounding areas. If we have a need, that would be present at the time.
Yes, Commissioner
Sure.
Houston.
And they are partially funded, correct? I mean, when they commit to having so many, you know, apartments in their buildings, they are receiving funding from, I don't know if it's another agency or the state or.
Right, so clients would have to apply for housing support funds and be eligible for that, and that happens through our financial services department. So they would have to be eligible in order to receive housing support and be in those units.
We have. Thank you, Diane.
All right, thank you, Diane.
All right,
Anything else?
Thanks, John.
If not,
thanks,
we'll
everybody.
adjourn at 2:54 hours.